and health insurance is a very important part of it. Now, what is insurance? Insurance is actually an arrangement by which a company or the state provides a guarantee of compensation for specified loss like death, disability, illness, for in return for payment of a specified premium. And health insurance is one of those insurance where insurance covers whole or part of the risk of a person and incurring medical expenses. Whatever the medical bill, part of or whole of it is carried out by that organization or state. This is health insurance. What they do, they estimate the risk of expenses and they develop a structure where somebody will pay a regular premium, maybe monthly or yearly, and they will enjoy some specific benefits in case of illness. The benefit is administered usually by a central organization such as a government agency or private business or a non-profit entity. Now, there is very interesting, significant historical developments. You will be surprised to know that even 6,000 years from now, during the 4000 BC, Babylonians had some insurance policy. And in our part of the world, the Hindus had, in 6th century, they had insurance in the name of bottomry contract. And the same practice was in Greece for 4th century. It was very simple. Whenever somebody going for a voyage, they were given some loan, and the guarantee was that if the shipment is lost in the sea, then don't have to pay it back. That was the bottomry method of insurance that has been in practice for last 6,000 years. And we know about Lloyd's. Lloyd's is the company which covers all the shippings of the world, and it was even established in 18th century. And in London itself, from 15th century, there was a well-developed insurance scheme. Health insurance originated mainly in Germany. You know, Germany, during the stage of industrializations, the factory owners realized that the health of the factory workers are important. If they are sick, they don't come for job, and there is a work loss. So they realized that it is important for them to maintain the health of the factory workers. So in late 19th century, when the legendary Otto von Bismarck, the father of the modern Germany, he was in power, he introduced several bills to legalize, to support health insurance. Now, what is the condition in Bangladesh? We don't have much more data for various reasons, but Health Economic Unit, which is a unit under the Ministry of Health and Family Welfare, Government of Bangladesh, conducted a study, and it was published on April 2020. This study covers actually the public servants and their families, the health condition and their requirement. It was found that almost half of the public servants either have one chronic disease or two. 36.5% have at least one disease, and 11.6% have two chronic diseases of the public servants. And if we go to their family, it's again almost 40% of their family members have some sort of chronic illness. And most prevalent illness are hypertension and followed by diabetes. Universal health coverage is a goal for Bangladesh under the SDG 3.8, and Bangladesh has to ensure universal health care by the year 2030. But unfortunately, we suffer from high level of out-of-pocket expenditures for healthcare. Out-of-pocket health expenditure means which the patient or patient's family spends for healthcare. That is called out-of-pocket expenditure. In our country, out-of-pocket expenditure share is 67.5%, whereas the government spending is only 23.3%. So a lot of our bills are on us. And that creates a scenario which is one of the major cause of poverty of our country. The high out-of-pocket expenditure for healthcare leads to the household poverty, and it is estimated that almost 13 to 15% of all poverty in Bangladesh actually originated from a catastrophic health event of a family member. So this is important for us to realize that many of our patients, when come to us, actually is coming with the last resort, last amount of property, or by a vicious cycle of loan, which will destroy the family economically. So what could be the solution? We came to know about the problem. The solution could be either strengthening of public healthcare facilities, or government could subsidize the public healthcare facilities. The NGOs and the non-profit organization could be involved into it. Voluntary health service, philanthropic health service by the healthcare workers can also contribute. And organizing individual donors is another aspect. But finally, two important aspects. One is a national health insurance policy or private health insurance companies. They could be of help. Now, what is the benefit of healthcare insurance? Healthcare insurance mostly in our country still are provided by the companies for the corporate companies for their workers. It gives the companies some advantage. They maintain a positive working relationship between the employee and the employer. They assist in the retention of the competent and skilled work. The company who offers healthcare insurance, their workers tend to say, they don't tend to leave. And it gives a sense of gratitude towards the company. And for the employees, it assures proper treatment in the event of illness, and they give the chance for them to use sophisticated treatment facilities. There are some additional benefits. We get income tax benefits. There are some saving schemes associated with health tax. We often have to have for traveling and visa, immigration. Then it may be part of life insurance. It gives a safety net against disability, and sometimes the group insurance also helps. It is the Bangladesh scenario at a glance. Bangladesh has 35 life insurance companies and 46 non-life insurance companies, and only top firms used to prevent health influence in Bangladesh. Here you can see that out of 16 crore of population, only 90 lakhs, 16 crore, 90 lakhs have any form of insurance, and only 10%, just a tiny portion, this small tiny portion here, has health insurance. So that is the status of healthcare insurance in Bangladesh. So there are two types of healthcare insurance here in offer: standalone healthcare and life insurance policies. Now, for the cardiac care providers, this is very important, as cardiovascular disease accounts for almost a third of death and disability. And it is one of the major causes of out-of-pocket expenditure and catastrophic health event. Hence, the cardiac care providers should consider the issue of patient expenditure. We often tend to forget, but we have to remember about the patient's expenditure and the health economics. And it should be encouraged to use insurance companies. There are some problems, often not proper facilities available. There are financial constraints, religion and social stigma, fraudulent history, and lack of awareness. Before ending, even in United States, healthcare financing is a problem, and President Barack Obama introduced Affordable Healthcare Act during his tenure, which provided some assurance for the poor section of the society. But even in that country, there is severe protest against that. And you can see in this map, this is the poor areas of the USA, and this poor area have not accepted or rejected that. That is the unfortunate. So often the political will does not match with the economic requirement. And we have to remember that. These are the few healthcare companies in Bangladesh, the top 6. You can see the names. There are a few others. So in conclusion, we would say that healthcare financing issue remains a key agenda in global health policy. And rising healthcare cost and large share out-of-pocket expenditure are major hurdles for the poor to break out of the poverty cycle. And as cardiologists and cardiac surgeons, we have to remember that cardiovascular care is one of the major areas where out-of-pocket expenditure results into catastrophic health event and poverty and economic destruction of a family. We have to remember that. Hence, cardiac care providers should be considerate and encourage insurance for the patients. State and private agencies should explore and expand the healthcare insured facilities for betterment of the society. Thank you all for your patient hearing.
Thank you, Sumon.